Are you eligible for disability because you have long-haul COVID? Is this why you have newly worsening neurological complications? And when will your smell and taste come back? These questions and more answered straight ahead. Because COVID can target multiple organs, long COVID symptoms may arise from lasting damage in these areas. In a 2021 study published in The Lancet, researchers found that almost 70% of people who recovered from COVID-19 and were discharged from the hospital continue to show at least one COVID-related symptom. There is currently no clear timeline on when people's long COVID symptoms resolve either. Data from the Zoe COVID study found that 1 in 10 people continue showing symptoms for over 3 weeks. This has come to be known as post-acute COVID-19 syndrome, or PACS. Meanwhile, a December 2021 study published in the American Journal of Physical Medicine and Rehabilitation found that long COVID symptoms can last for at least a year. Senior author of the study, Dr. David Putrino, said, "This study is a concerning reminder of how severely debilitating PACS symptoms are, the toll they take on health and wellness, and the fact that without active treatment, these symptoms appear to persist indefinitely."
Some days are up, some days are down. I would say the mornings are better for me, and then by like 1 or 2 o'clock is when my voice and my shortness of breath kick in more.
His research also found that the most common long COVID symptoms were fatigue, brain fog, and headaches. Additionally, physical exertion, stress, dehydration, and weather changes made symptoms worse. While some long COVID symptoms disappear after a few months, others are for life. More research is linking long COVID to diabetes. A 2022 CDC study found the risk of developing diabetes a month after recovering from COVID-19 infection increased by 166%. According to The Ohio State University, there are possible but still unproven reasons for this. Prior research shows the immune system produces all types of antibodies in response to infections, including ones that target pancreatic cells involved in making insulin. Attacks on the pancreas lead to a drop in insulin-producing beta cells. If a person was pre-diabetic, high-dose steroid treatment for COVID-19 illness and acute inflammation could have increased insulin resistance and elevated glucose to higher than normal levels. A 2021 study published in the journal Cell Metabolism also found that insulin resistance in severe COVID-19 cases was the main cause for later development of high blood sugar. People with long COVID may experience sustained lung damage, according to Johns Hopkins Medicine. The amount of damage in the lungs determines the severity of symptoms in people with long COVID. Mild to moderate lung complications include shortness of breath and pneumonia. Most COVID cases involving pneumonia are severe and may cause people to have trouble breathing for months. In severe long COVID cases, lung complications can develop into life-threatening conditions such as acute respiratory distress syndrome or sepsis. It's still a mystery why COVID causes lung-related long COVID symptoms in some people but not others. However, scientists from the University of Michigan are trying to find the answer. After looking at lung biopsies from people with ongoing respiratory symptoms after recovering from COVID-19 illness, they found that most lung damage came from a pre-existing lung disease. Most patients in their study had signs of usual interstitial pneumonia, or UIP, a chronic lung disease that causes stiffness and scarring of the lungs. Lead author of the study, Dr. Christine E. Konopka, shared, "We were seeing a lot of UIP, which isn't the pattern we tend to associate with acute lung injury." Dr. Konopka added, "So we think these are patients who had lung disease prior to COVID, and maybe they just weren't being followed by primary care physicians. They then had COVID, are still sick, and their UIP is finally being picked up." Beyond the lungs, COVID also targets and injures the heart. A July 2021 study published in the journal JAMA Network Open had people with long COVID track their symptoms using wearable devices. The results showed low heart rates 9 to 15 days after showing COVID-19 symptoms, and this lasted for almost 2 to 3 months after recovery. According to Johns Hopkins Medicine, COVID causes cardiovascular damage when it infects heart cells with ACE2 receptors. The infected cells trigger a response from the immune system, resulting in an increase in inflammation. On its mission to eliminate the virus, a prolonged inflammatory response may harm nearby tissue, such as the heart. Cardiovascular complications may also arise from blood vessel inflammation in severe COVID-19 cases. This happens because damage to vessels and blood clots can obstruct blood flow to and from the heart. Heart problems during long COVID can have long-term consequences for your health. Research presented at the Echocardiography Congress, EuroEcho 2021, found that about a third of people experience shortness of breath during physical activity a year after recovering from COVID-19 infection. These people had no history of heart or lung disease. After looking at their hearts through a cardiac ultrasound, the researchers found abnormal heart rhythms and cardiovascular damage that could explain the breathlessness. While COVID-19 was initially believed to be a respiratory infection, scientists now know that it can directly or indirectly affect the brain. Infectious disease expert Dr. Davidson Hammer told NBC Boston, "This is a systemic illness and it affects many parts of the body. The brain fog is something that is described in a number of different viral infections." Per the National Institute of Neurological Disorders and Stroke, or the NINDS, most people infected with COVID with neurological symptoms develop dizziness, headaches, muscle aches, and changes to taste and smell. A 2021 study published in Annals of Clinical and Translational Neurology found that people with neurological complications after recovery were more likely to report cases of brain fog and headaches.
I found that even with simple things like having conversations with my kids, I'm forgetting words.
I'm sorry, I find it very difficult to describe what it actually feels like.
For people who required intensive care during their infection, more severe neurological complications such as muscular weakness, nerve injury, and pain syndromes may emerge. With insufficient oxygen, permanent brain damage is likely. On rare but serious occasions, COVID-19 can induce seizures, blood clotting in the brain, and stroke. Inflammation or a lack of oxygen in the brain from COVID may affect neuronal communication between different brain areas, a condition called diffuse white matter disease. A common neurological symptom experienced by people who develop COVID-19 infection is a loss of smell and taste. While most people recover their senses, a small minority remains impaired. According to the NINDS, people lose their senses because COVID damages nerve cells. It specifically damages nerve cells that are involved in both detecting smells or flavors and sending that information to the brain. Repairing damage to these cells requires replacing them with new ones, and these can take a few weeks or even a few months. A November 2021 article published in the journal JAMA found that, on average, 700,000 to 1.6 million people lose their sense of smell for 6 months or more. If you're feeling out of breath just from walking, it may be a sign of myalgic encephalomyelitis or chronic fatigue syndrome, or ME/CFS. According to Johns Hopkins Medicine, about 1 million to 2.5 million people are affected with ME/CFS, and with the COVID-19 pandemic, more people are reporting similar symptoms after recovery. Common symptoms of ME/CFS include severe or debilitating fatigue, trouble sleeping, brain fog, and a flare-up of symptoms after making a physical or cognitive effort to do things. An August 2021 review published in the Proceedings of the National Academy of Sciences revealed a possible connection. Researchers suggest that ME/CFS after COVID-19 infection is caused by biological processes that become abnormal after infection. According to the review, there are several things that lead to this. Some of them are an increased inflammation in the brain and body, the cell's inability to produce ATP, and a redox imbalance. These could all lead to symptoms akin to those of ME/CFS. Lead study author Bindu Diana Paul told Johns Hopkins Medicine, "The body's response to infection and injury is complex and covers all body systems. When that response is in disarray, even just one aspect of it, it can cause feelings of being tired, brain fog, pain, and other symptoms." A potential effect after recovering from COVID-19 infection is kidney damage. A 2021 study in the Journal of the American Society of Nephrology found that COVID-19 infections, including mild cases, have an increased risk of kidney disease. That said, the risk of impaired kidney function was higher among people hospitalized in the ICU. Assistant professor at Washington University, Dr. Ziad Al-Ali, shared in a press release, "Based on our research, we believe that 510,000 of those people who have had COVID-19 may have kidney injury or disease." According to an article published in the journal Nature Reviews Nephrology, COVID may induce a higher risk of kidney disease. This is because of its direct and indirect methods for causing acute kidney injury. Direct injuries could come from high inflammation around the area or damage to the inner layer of blood vessels. Indirect effects are from medications used to treat COVID-19 infection but are toxic to the kidney, inflammation from the rest of the body, and other diseases. Postural orthostatic tachycardia syndrome, or POTS, is a condition that can arise after recovering from a viral or bacterial infection. According to Johns Hopkins Medicine, COVID-19 infection may cause POTS-like symptoms such as severe fatigue, increased heart rate, chronic nausea or vomiting, shakiness, and brain fog. POTS happens when the autonomic nervous system starts to go out of whack. POTS symptoms can be debilitating, making it difficult to resume activities from before you were sick. Director of the Johns Hopkins POTS program, Dr. Tae Chung, said, "We are being very careful with regard to diagnosing our patients with POTS, as we know COVID-19 can cause blood clots or scars in the lungs, which can cause similar symptoms as POTS but would require very different treatment. If you are diagnosed with post-COVID POTS, doctors will most likely personalize your treatment based on the severity of the symptoms you exhibit. This can include aggressive hydration, making changes to the diet, and prescribing medication. After several months of treatment, you may undergo physical therapy to strengthen muscles that may have weakened after infection." The COVID-19 pandemic has been universally traumatizing for those who have lost friends and family or who are paranoid of getting themselves or their loved ones infected. Adding to these worries, people with long COVID experience a higher chance of developing mental health problems after recovery.
For me personally, I was so focused on getting well physically that I kind of put the mental part aside.
A 2021 study published in The Lancet Psychiatry found about 33% of people recovering from COVID-19 infection were diagnosed with a neurological or psychiatric condition. For 12% of people, this was their first mental health diagnosis. A separate study published in The Lancet found that 23% of hospitalized patients who recovered from COVID-19 infection went on to develop symptoms of anxiety and depression. Meanwhile, research from 2021 shows that about 10.5% of people develop PTSD 9 weeks after recovering from illness. COVID is associated with damage to the brain, but new or worsening mental health conditions may also stem from the experience of dealing with the infection rather than the virus itself. For instance, people might find the idea of being close to death traumatic or feel anxiety over the gaps in memories after being intubated in the hospital for weeks. Clinical health psychologist Caitlin LaGrotte told the American Psychological Association, "It's helping them deal with that loss of time and how their body and mind are both recovering from what they've just been through." If you or someone you know is struggling with mental health, please contact the crisis text line by texting HOME to 741-741. Call the National Alliance on Mental Illness helpline at 1-800-950-NAMI. That's 1-800-950-6264, or visit the National Institute of Mental Health website. One way or another, long COVID can cause physical and mental impairments that can significantly impact many people's day-to-day activities. For this reason, the U.S. Department of Health and Human Services officially recognizes long COVID as a disability. People with long COVID are now eligible to apply for disabilities and approved on a case-by-case basis.
It's an important step for those who have not gotten a medical solution but who need a legal one.
If approved, it entitles them to accommodations from school, businesses, and governments, such as providing refuel assistance or the use of a service animal if necessary. According to CNBC, hiring a lawyer familiar with disability applications can maximize your chances of getting benefits. It's also important to apply early because getting legal representation and the application process itself can take months. Rebecca Vallis, a senior fellow at the Century Foundation, shared that many, particularly those without legal representation, end up wrongfully denied on multiple occasions before finally being approved with a lawyer's help. Also, keep in mind the financial restrictions when it comes to being eligible for disabilities. Only people who are not working, are not able to work for at least a year, paid FICA taxes for 10 years, and individuals whose income fall below $1,310 per month are eligible for disabilities. Check out one of our newest videos right here. Plus, even more Health Digest videos are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.